me about the center at the Mayo Clinic, when it was established, and why it was important for the Mayo Clinic to move in that direction.
We're about 8 years old now, and Mayo invested in innovation to really help it advance its mission of caring for people. For years, we've always said that the most important consideration is the best interest of patients, but at the Center for Innovation, we believe it's our mission to transform the way that people experience health, not just health care. And Mayo, by the way, has, over its history, worked to help people out of some very difficult health care circumstances, but now has made it clear that for our future, we need to also help people with their health. And our CEO has given us a great challenge of touching 200 million people a year in a meaningful way by the year 2020.
Can you talk about the patient experience at Mayo?
Many people say that you can't really describe it, you have to truly experience. That is, you have to go and see what integrated care is like if you've never seen it before. People have traveled to Mayo from other organizations to try to learn how we do things and have not always been able to easily reproduce it. It's a culture. It really is something that has developed over the years, but our hope is that we can translate that culture that has developed in face-to-face visits in Rochester to really help people with their experience of health with Mayo as a partner in their lives every day, wherever they might be.
Terrific. Can you give me some specific examples of how you've improved that patient experience?
We have learned in our research that people largely believe that healthcare delivery systems tend not to be very helpful to them because they either don't listen or they're not there when people need them. We've actually heard, quite simply, we should be there for people when they need us. So we've changed that into a little bit of a tagline, always be there for me. So sometimes it means improving the experience of care in Rochester, and sometimes it means improving the experience when people are at home. We've done projects to change the way that expectant moms experience their pre-delivery obstetrical care. So in that little project that we called OB Nest, we actually gave moms ultrasound monitors that they could take home and listen to their babies at home. And got away from the old idea that you had to show up every certain time for a little visit that didn't have a lot of value necessarily, but we could give you a connection with your baby that you never had at home. Now you see that, of course, in things like Apple's newest offerings, but those are things that really change the experience of health. And we've done similar things for people with heart disease and asthma and cancer and obesity with bariatric surgery. Generally, we've learned that when you start thinking about people, you do things very differently.
So I want to say, having been to the Mayo Clinic and having felt that feeling that you were talking about, that intangible feeling, there seems to be a disparity between adding more technology and thinking about people, but really the opposite is true. How do you use technology to enhance that people-to-people, person-to-person connection at the Mayo Clinic?
So for us, the fundamental way to do that is to first understand what people really need, and then later use the tools that will likely allow you to meet those specific needs. If you look at how people experience their healthcare journey, you discover pretty quickly that there's almost always some personal connection that's necessary sometime, but it's not always the same. So some people need a lot of personal attention during the early phases of the journey when the diagnosis isn't so certain, or maybe it's an ominous diagnosis, and you need a lot of comfort as a person to understand what the diagnosis means for my life. Sometimes, actually, people are going along just swimmingly, having no trouble whatsoever, and then they hear something that's a little discomforting or unsettling, maybe from a coworker or from a neighbor, or maybe there's a news item, and it creates immediately a strong sense of uncertainty. Well, sometimes that might be solved with a little email or a phone call, maybe a Skype visit, but sometimes it needs time for personal reflection. So every person's different, and you have to be able then to use your technologies and resources to meet an individual's specific needs, not a one-size-fits-all.
So what is your observation, your reflection then, as you're here at the conference and you see all of these wonderful technologies coming out? What do you see down the line? Do you see just a whole new expression of the person-to-person connection in healthcare?
So I don't think that will happen as long as we focus just on healthcare. But if we think more about health and how technologies can facilitate a person's health, then we might actually make that connection. It's really quite striking to me. I see a number of people who come to my office as a cardiologist and want to know about their risks for heart attacks and what they should be doing. And many of them bring their wearables, and I ask, well, what are you doing with this? And most of them say, well, I just look at it every day. And I say, well, for what? What does it tell you? Most of them don't have a sense of what it is they should be looking at. But if I can actually help them understand what they're trying to accomplish and then be able to use the technology in a way that they can do so, that's really what will make us achieve that connection. But just for somebody to go out and buy the technology, go use it and say, I've used this when they come in, really isn't going to get us where we need to be. There has to be a true partnership between a physician or a nurse or a provider and a person trying to make their lives better. So you agree on what the technology will help you know and how it will help you change the way you do things or actually sustain the way you do things for the goals that you want to achieve.
Wow. Last question for you. What would you say to other providers? What advice would you give them about rolling out new programs? You talked about things like OB Nest and those kinds of programs. What advice would you give as other providers are embracing new technologies and then rolling them out?
The first and fundamental piece is to really understand people and recognize then that you probably don't have to invent any new technologies. You really have to think more about how you integrate the technologies to achieve the goals that you and people have together.
Terrific. Anything you want to add that we didn't cover?
I think you've got the message.
Wonderful. Thank you.